students, welcome back to our Pharma YouTube channel. Today we are going to complete the chapter 1 of Pharmacotherapeutics. In our earlier video, we have completed the part 1 of this chapter. The link will be provided in the description box of the part 1. Please go and watch the part 1 video before this video. Like, share and subscribe for more such videos. So, let's start with the today's video, that is second part of the chapter 1 of Pharmacotherapeutics subject. First point is the evidence-based medicine. Definition: evidence-based medicine (EBM). It is an approach to medical practice that uses the results of a patient care research and other available objective evidences as a component of clinical decision making. Or another definition is evidence-based medicine (EBM) is the explicit, judicious and reasonable use of modern best evidence in making the decisions about the care of individual patients. It is a movement which aims to increase the use of high quality clinical research in clinical decision making. So in simple words, what we can say that evidence based medicine, it is an approach to the medical practice which uses the results of the patient care research and the appropriate evidences for making the clinical decision for the better outcome of the patient. Objectives of EBM. These are the following objectives of the EBM process. First, it is to utilize the current knowledge and connect it with the patient preferences and clinical expertise to standardize and improve care processes and ultimately the patient outcomes. What does it mean? We have to use the knowledge and connect this knowledge with the patient preferences and the clinical expertise to improve the patient outcomes. Second objective is to recognize an information which is needed while caring for a patient. We should be able to recognize what information is needed while taking the care of a patient. Third objective is to identify the best existing evidence to help resolve the problems. We should identify the best existing evidence or the best existing proof which can help to solve the problems of the patient. The fourth objective is to integrate the evidence into a medical plan. We should integrate or convert the evidence or proof into a medical plan which will be helpful for the patient. Next point is steps involved in applying the EBM process to pharmacotherapeutic decision making. There are total 4 steps which are involved in applying the EBM process to a pharmacotherapeutic decision. First step is recognize information needs and convert them into answerable questions. That is, we should recognize the need of information and convert this need into an answerable question. That is, we have to frame some questions. The next step is conduct the efficient research for the best evidence with which to answer these questions. Whatever we have framed the questions, to get the answers of this question, we should go thoroughly a thorough research through which we can find out any best evidence or best answers to our questions. The third step is to critically appraise the evidence for its validity and usefulness. We should critically check the evidence for its validity and usefulness. Next, fourth step is apply the results to patient situation to best assist the clinical decision making. Whatever the results we have got through these steps, we have to apply the results to the patient situations to make the correct decision for the betterment of the patient. Merits of evidence-based medicines. These are the several merits. That is, first one is it minimizes the error and optimizes the quality in a patient care. Second, it reduces the cost of the treatment. Third merit is it provides guidance to all the groups with a rigorous and acceptable framework for making any complex decisions. Fourth merit is it enables the professions to be confident in their decisions and to communicate them effectively to the fellow colleagues and the patients. Next point is the essential medicine list. The definition of essential medicine list, as the name suggests, essential drugs are those which satisfy the priority healthcare needs of majority of the population and therefore Fourth, they should be available at all the times in adequate amounts and in appropriate dosage forms, which means that essential drugs are the drugs which satisfies the health care of the public, and these essential drugs should be available at all the times in adequate amounts in adequate or proper dosage forms for the betterment of the public. Model list of essential drugs. The WHO model list of essential medicines are updated every 2 years by the expert committee on the selection and uses of essential medicine. The first essential medicine list was published in the 1977 year, and the first essential medicine list for children was published in the year 2007. The current versions updated in September 2021 are the 22nd essential medicine list and the 8th essential medicine list for children. In 1977, the first model list was published with plus 200 active substances, and this list is revised every 2 years by the WHO expert committees. March 2007 list contains 340 active substances, and the next revision took place in the 2009 year. Essential medicines is important in developing countries because of the following reasons, that is, for the development of treatment guidelines, development of the national formularies, and to measures to use information to improve the drugs for patients and the general public. WHO model list consists of the core list and the complementary list. Core list, it is a list of minimum drugs needs for a basic healthcare system, listing the most efficacious, safe, cost effective medicines for priority conditions. These are selected on the basis of burden of diseases and potential for safe and cost effective treatment. The second, that is complementary list, essential drugs for priority diseases which are cost effective but not necessarily affordable or for which specialized healthcare facilities may be needed. National List of Essential Medicines of India, that is NLEM. The essential medicines list, it is needed to be country specific, which addresses the disease burden of the nation and the commonly used medicines at primary, secondary and tertiary healthcare levels. Ministry of Health and Family Welfare, Government of India hence prepared and released the first national essential medicines of India in 1996, and which consists of 279 medicines. The list was subsequently revised in 2003 and had 354 medicines. Later in 2011, the list was revised and had 348 medicines. In comparison to NLEM 2003, number of medicines deleted is 47 and 43 medicines were added. Three categories of drugs are included in this list. These are primary, secondary and tertiary. Next point is the standard treatment guideline, that is STG. Standard treatment guidelines, it is also known as the treatment protocol and the prescribing policies. The definition is STG, that is standard treatment guidelines, are defined as systematically developed statement which is designed to assist the practitioners or the prescribers and the patients in making the decisions about appropriate treatment and the healthcare for specific clinical problem. These guidelines usually helps to choose between the optimal treatment options within a health facility. In fact, they represent one of the approaches to promote the therapeutically effective and the economically efficient use of the medicines. STG lists the preferred pharmacological and non-pharmacological treatment for the common for the in a specific health system, which means that standard treatment guidelines means we have to follow some guidelines or some protocols to make the decisions about the appropriate treatment for the patient. Features of a successful SDG manual. First is simplicity. The number of health problem is limited to a commonly observed condition. Each clinical condition lists a few silent features with a clear and concise information about the pharmacological and non-pharmacological treatment. Second is credibility. These guidelines are developed by the most experienced clinicians in the country, and the revision is based on the actual experiences by them. Third is treatment standards for all levels of healthcare facility. Healthcare providers uses the same standard treatment guidelines. However, the referral criteria may differ. While the first choice treatment for a patient depends upon the patient's diagnosis and the condition of the patient and not on the prescriber. Next feature is medicine supply based on the standards. The supply of medicines must match with the standard treatment and list of essential medicines. The next is regular updating. Any changes in the therapeutic options or the bacterial resistance pattern should be incorporated in the revised version to reflect the current recommendations. The last one, it should be user friendly. The STG should be published as small, durable pocket manual which make it convenient to carry and use. Here we have completed the chapter 1 of pharmacotherapeutics subject. Like, share and subscribe for more such videos.